Good evening to all. Am I audible? Good evening to all. Hello. Am I audible? પાર્થને પૂછને પીપીટી પીપીટી દેખાય છે એવું પૂછને તું વાત કરી પીપીટી દેખાય છે ને મારો ઓડિયો દેખાય છે વેઇટિંગ જ આવે છે હજુ પણ हेलो हेलो पीपीटी दिख रहा है आपको अभी वो डायग्राम दिखा आपको मेरा इंट्रोडक्शन वाला ना मेरा नाम वाली स्क्रीन कर देता हूँ कैन यू सी माय नेम नाउ जी કે આ લિંક મોકલી છે ઓન કરીને કે નવી લિંક મોકલી છે ઓન કરીને Good evening to all students. This our today's live webinar is for the homeopathic student. If you had studied the upper limb and lower limb as per the CBDC or at other curriculum, still it needs to recap in a concise manner so that you can utilize in AIPGT examination, or if it is studied with the applied anatomy, then it will be useful in your clinical setup also later on. So with this aim and objective, let us consider our rebrushing of these nerves and the muscles of the upper limb as well as lower limb. To make it easier, I like to compare the upper limb and lower limb. In upper limb, as you have a axilla and the brachial plexus, you can compare it with the gluteal region of the lower limb, where we have a little comparable study, but in a arm and the thigh, in a forearm and the leg, and in a hands as well as foot, there is a quite comparable study. So let us go to our next slide. Here I had projected this brachial plexus. You can see there is a root, trunk, divisions, cords, and various terminal branches for the upper limb. Now, below the clavicle, that is a cord part, especially the lateral cord, posterior cord, and the medial cord, are quite in relationship with the second part of axillary artery. What I mean to say, in second part of axillary artery, lateral to the artery is the lateral cord, medial to the artery is the medial cord, and behind the artery is the posterior cord. So it will be very easy to remember the walls of the axilla formed by the various muscles and respective muscles supplied by the respective cords. Say for example, lateral wall of the axilla is formed by the you can say coracobrachialis and coracobrachialis and sorted of the bicep brachii. So this lateral cord of the brachial plexus, which continues beyond your lower border of teres major as a your musculocutaneous nerve. So, sorry, hello, हाँ जी. અત્યારે લાઈવ ચાલુ છે એટલે પછી વાત કરીએ. નવી લિંક મોકલી છે એ ઓપરેટ કરો. એને વાત કરો નવી લિંક નવી લિંક છે ઓપરેટ કરશો તો પાવર પોઈન્ટ પ્રેઝન્ટેશન દેખાવું જોઈએ અથવા વિડીયો દેખાવો જોઈએ. સારું ઠીક છે. So, sorry for interruption. This lateral cord of brachial plexus, it gives musculocutaneous nerve. Hence, you can say both the muscles at the lateral wall, which are sorted of the biceps and the coracobrachialis, they are supposed to be supplied by the musculocutaneous nerve as a rule. Similarly, you can say the posterior cord, it gives the various branches, 5 branches, out of which first 3 branch, that is the upper subscapular nerve, nerve to latissimus dorsi, and lower subscapular nerve, they supply the muscles forming the posterior of axilla. So, muscles of posterior of axilla are subscapularis in upper 2/3 part and teres major and the latissimus dorsi in lower part. Here, subs correlated with the upper and lower subscapular nerve. But for nerve to latissimus dorsi, it's also easy to consider. But what about the teres major? So this teres major is supplied by the lower subscapular nerve, and this is the unique point you have to remember as far as objective exam is concerned, either at the PG level or at the some government examination or UPSC examination in short. So keep this in your always mind for objective question, that lower subscapular nerve supplies not only subscapularis but also supplies the teres major muscle. Now, anterior wall, there is a pectoralis major and minor. They are supplied by the lateral and medial pectoral nerve respectively, branch from the lateral cord and the medial cord. Similarly, there is one muscles in a medial wall of axilla, that is the serratus anterior. So it is supplied by the one nerve that is known as the long thoracic nerve. Another name is the nerve to serratus anterior. In applied, you will get the third name, that is the nerve of the bell. So this is the branch from the root of the brachial plexus, and in a root of brachial plexus you will have a 2 branch. One is the nerve to serratus anterior and another is a nerve to rhomboidus. And idea to remember is that at the medial border of the scapula, in a costal aspect serratus anterior is inserted, in a dorsal aspect rhomboidus major and minor inserted. So nerve to rhomboidus supplies not only rhomboidus major and minor but also supplies the levator scapulae. So levator scapulae again you can additionally remember for the supplied by the nerve to the rhomboidus. This is regarding the roots. Then how we can miss the upper trunk? From upper trunk there are 2 branches. One is the suprascapular nerve and another is the nerve to subclavius. Now nerve to subclavius is obvious, it will supply the subclavius muscle at the pectoral region, but suprascapular nerve you have to careful. Here this suprascapular nerve supplies supraspinatus as well as infraspinatus. So supra and infra is in contrast. So this is another one glitch where the student can fumble. So remember, supraspinatus as well as infraspinatus, they both are supplied by the suprascapular nerve, and it is a branch from the upper trunk. So after completion of this brachial region in a completion of the axillary wall, let us compare with the gluteal region of the lower limb, where the gluteus maximus, gluteus medius, gluteus minimus, these are the 3 muscles are there, and out of which you can say they are supplied by the superior and inferior gluteal nerve. Now there are other deeper muscles also. There are superficial muscle at the gluteal region and the deeper muscles like piriformis, that is the, you can say there is another one muscle that is obturator internus, obturator externus, two gemelli. So they have their respective nerve supply. So now, except these two region, rest of the part of the limbs like arm can be very comparable with the thigh, muscles of the forearm very comparable with the leg, muscles of the hand are very comparable with the muscles of the your foot. In a foot there are 17 muscles, whereas in hand there are 20 muscles. That is the one difference student must remember. There are 20 muscles in a forearm, just like in a hand 20 muscles, forearm has also 20 muscles, around the shoulder also there are 20 muscles. So in upper limb about 60 muscles are there, and their nerve supply is to be remembered in a very comparative manner to the lower limb. So for comparison, in respect to the hand, if there are you can see the comparable things of the number with the foot, then there are 17 only. Whereas in a leg there are 1 dozen muscles, about 12 you can say. Similarly, more than 12 muscles are in a thigh, but in your arm and forearm it is a different. In a arm there are only 4 muscles, you can say front of forearm 3 and back of forearm 1 muscles. But it has been increased greatly in a forearm by the multiple muscles, say 12 muscles in the front of forearm, and you can say 8 muscles in the front of forearm and the 12 muscles in the back of forearm. Now let us complete the first arm. In an arm there are 3 muscles, biceps, brachialis and the coracobrachialis. All 3 are supplied by the musculocutaneous nerve. Hence musculocutaneous nerve is known as the chief nerve of the front of the arm. Here one exception you must keep for your exam point of view, that brachialis has a double nerve supply. This brachialis has motor nerve from the musculocutaneous nerve as a rule, but proprioceptive nerve supply is from the radial nerve. Before radial nerve enters in a cubital fossa, it gives branch proprioceptive in nature, not motor in nature. So this is very, very focusedly you have to remember. Similarly, in comparison to upper limb, in lower limb, adductor magnus is a similar muscle having a double nerve supply comparable to the brachialis. Adductor magnus is also supplied by obturator nerve. So sciatic nerve and your obturator nerve both supply adductor magnus. Here it is mentioned that adductor magnus has a hamstring part as well as adductor part. Triceps muscle is there, solely supplied by the radial nerve, and that same radial nerve also supplies directly anconeus and brachioradialis. Rest of all back of the forearm muscles are supplied by the one of the branch of the radial nerve. They are the posterior nerve. We'll like to see as a muscles of the forearm, and then nerve supply. So there are 12 muscles in a muscles of forearm, and all those 12 muscles can be divided into 2, 7 superficial and 5 deep. 5 deep muscles are supplied by the posterior introsseous nerve, but among the superficial muscles you can say your brachioradialis, anconeus and sorry for the interruption, brachioradialis, anconeus and extensor carpi radialis longus. They are supplied directly by radial nerve. Rest of the all 9 muscles, they are supplied by the posterior introsseous nerve. Now regarding your front of forearm, in a front of forearm there are 8 muscles, out of which superficial muscles are mainly supplied by median nerve directly, but deeper muscles are indirectly branch from the median nerve, that is anti-introsseous nerve will be supplying the deeper muscles. But as I said, everywhere there is an exception. Just we had studied that in the front of the arm, out of the 3 muscles, 2 muscles are supplied by the 2 muscles are only supplied by musculocutaneous nerve, but the brachialis, third muscle, is supplied by the 2 nerve supply. Similarly, in your front of arm, front of forearm, out of 8 muscle, 1.5 muscle are supplied by the ulnar nerve. Namely, you can say your flexor carpi ulnaris is supplied by the ulnar nerve. Rest of all 4 superficial muscle, that is the pronator teres, flexor carpi radialis, this muscle which you can see, that is a palmaris longus, and flexor digitum superficialis. These four muscles are supplied by median nerve, whereas fifth muscle, flexor carpi ulnaris, is supplied by the ulnar nerve when it is passing beneath the same muscles in a dissection. Similarly, this ulnar nerve will also supply the half deep muscle, that is the ulnar half of the flexor digitum profundus is supplied by the ulnar nerve, and the others are supplied by the વાત કરે કે ઉચકીને કરે પછી વાત કરો. That deeper muscles is supplied by the mainly anteriointrosus nerve, which is a branch of median. The 2.5 muscle are supplied by the anteriointrosus nerve, but half muscle, that is a deeper ulnar half of the flexor digitum profundus, is supplied by the ulnar nerve. So ulnar part of the deeper muscle and the flexor digitum superficialis of the super muscle group. This 1.5 muscle is supplied by the ulnar nerve, and rest of the other muscles directly or indirectly supplied by the median nerve. That's why main nerve, chief 25, almost 5 muscles are supplied by the median nerve. Rest of 15 muscles are supplied by the ulnar nerve. Before we go into details of the hand, let us compare this thigh muscles with the arm and leg muscles with the forearm. In a thigh, there are three regions. Front of the thigh, only two muscles, quadriceps femoris and the sartorius. Both are supplied by the femoral nerve, no exception. In adductor compartment, there are adductor muscles and gracilis. They all are supplied by the obturator nerve. Exceptionally, adductor magnus is also supplied by the sciatic nerve. In the back of the thigh, there are hamstrings muscle. All are supplied by the sciatic nerve. But it is to be mentioned that sciatic nerve is a two-part, tibial part and the common peroneal part. Tibial part is supplying the hamstrings muscle proper, whereas peroneal part is supplying by the short head of the biceps femoris. Now, coming to the leg. In a leg, there are dozen muscles, say 4 muscles in an extensor compartment or front of the leg. You can say 2 muscles in the lateral compartment of the leg, and the rest of the muscles in the back of the leg or the calf muscles. Calf muscle are the superficial muscles. There are only 3. Still deep to the calf, there are deeper flexor muscles in a leg or back of the leg. So, comparable to the extensor and flexor compartment, there is a extensor pollicis longus, extensor digitorum longus. So, in a flexor compartment, you have a flexor digitorum longus, flexor hylucis longus. Additionally, there is tibialis anterior and tibialis posterior in respective compartment. So, 4 muscles in an anterior compartment or extensor compartment are tibialis anterior, extensor hylucis longus, extensor digitorum, and peroneus tertius. Peroneus longus and brevis, they are in a lateral compartment. The third muscles, which is in an external compartment, that is a peroneus tertius. All 4 extensor muscles or anterior compartment muscles, they are supplied by the deep peroneal nerve, whereas peroneus longus and peroneus brevis, they are supplied by the superficial peroneal nerve in a lateral compartment. This superficial peroneal nerve, sometimes also known as a musculocutaneous nerve of the lower limb. This is a small point, but you have to remember as far as your exam or competitive exam are concerned. So remember, who is the musculocutaneous nerve of lower limb? So superficial peroneal nerve. Why? Because it pierces the peroneus longus and become cutaneous in a dorsum of the foot. Just like your musculocutaneous nerve supplies the muscles and then become cutaneous nerve for the forearm. So now back of the leg, they are supplied by the tibial nerve, whether it is a calf muscle or the deeper muscles. Calf muscles are supplied by the tibial nerve of the popliteal fossa, whereas deeper muscles are supplied by the same tibial nerve but in the back of leg when it arrives. So lastly, let us compare with the hand and the foot. In a hand, there are 20 muscles. To remember 20 muscles, you have to only cram for the thenar muscles and hypothenar muscles. Rest of 1 dozen muscles, 12 muscles, can be remembered by only 2 names. One is the introssi muscle, they are 8, and the 4 are the lumbricals muscles. Lumbrical muscles helps in a pen grip for action, to mention. Adductor, your introssi muscles, they are 2. palmar introsi, they are adducting, and dorsal introsi, they are abducting the finger, like this, adduction, abduction of the finger. So adduction of the finger by the palmar introsi, as if you are moving towards the palm, and dorsal introsi, they are abducting the finger as if you are spreading the finger or opening the fist. 4 lumbricals, already I said they are for the pen grip. Now thenar muscles, they are for the thumb, hypothenar muscles for the little finger. So here are the abductor pollicis longus, flexor pollicis longus, opponens pollicis, and the fourth one is the adductor pollicis in a center. Similarly here, abductor digiti minimi, flexor digiti minimi, and you can say opponens digiti minimi. This is opponens action. And there is a 1/4 muscles which is a subcutaneously inserted here, and that is a palmaris brevis. Just palmaris brevis takes origin medial to the insertion of the palmaris longus. The tendon is very visible at the forearm when you will slightly flex the wrist joint. So all this intraossei muscle, they mainly takes origin from the anterior aspect of flexor retinaculum. You can refer to your chaurasya. I had kept certain other slide also for this tabulated form. You can see one table. This table recapitulates all the muscles around the scapula, shoulder, arm, and the, you can say, forearm. Forearm again I had divided in a flexor compartment and extension compartment, and the muscles of the hand which we had completed just now. Now these are the muscles at the lower limb, muscles of the hip and the, you can say, thigh. There are only 3 compartments, anterior, medial and posterior compartment. Posterior muscles compartment muscles are also known as the hamstrings muscle. Medial compartment muscles are also known as the adductor muscles. Most medial muscles of the thigh is the gracilis, that is to be remembered. Anteriorly ribbon-like crossing muscle is the sartorius, and another muscle is the quadriceps. Quadriceps is the forehead, 3 vasti and the rectus femoris. Then in the leg there are again 3 compartments we had discussed. Now just like hand, in a hand we have all thumb muscles, they are supplied by the, we can say, median nerve, except adductor pollicis. Adductor pollicis is supplied by the ulnar nerve. Out of 4 lumbricals, 2 lumbricals are supplied by the median nerve, first 2, lateral 2. Medial 2 or ulnar 2 lumbricals are supplied by the ulnar nerve. So you can say out of the 25 muscles are supplied by the median nerve, first and second lumbrical, and the 3 muscles of the thenar eminence. Similarly, rest of other 15 muscles are supplied by the ulnar nerve. Here you have to remember the lumbricals is supplied by the both ulnar and the median, but first and second and third and fourth respectively. Now after synopsis of this your muscles of the hand, let us go to the synopsis of your foot or ankle. There are 17 muscles, here 20 muscles. Why there are 17? Because instead of 8 introsi muscle, there are only 7 introsi muscle. Whatever I had spoken here today, you can refer to your BD Chaurasya volume 2, page number 143 now 7th edition, 144 page 7th edition, and 145 7th edition. In a 145 7th edition, you will have a layer wise arrangement of these muscles, which is again in one of the reference I had taken. Here there is a typological error. Instead of abductor, they had written adductor twice. So corrected the first layer, there is a abductor hylucis, flexor digitorum brevis, and abductor digiti minimi. So this first layer, second layer is long tendon and the 2 small intrinsic muscles like lumbricals, and you can say that is your digitorum accessorium, flexor digitorum accessorium, third muscles which is very peculiar of the lower limb only. Then the third and the fourth layer, you can third layer there are flexor hylucis brevis, adductor hylucis, just like adductor pollicis in the upper limb, and flexor digiti minimi. Fourth layer, they are the introsi. You can see that palmar introsi, plantar introsi instead of palmar, plantar introsi, there are only 3, whereas dorsal introsi 4. So there is a reduction in the number of total number in the sol. They are only 17. To remember nerve supply, just comparable to the hand, where are 5 muscles are supplied by the median nerve, rest are supplied by the ulnar nerve. Here you can remember lateral and medial plantar nerve. Medial plantar nerve supplies only 4 muscles. Here in this table there is a typological error, so I refer to your BD Chaurasa volume number 2, 145 page in a 7th edition. You can see the 4 layer and very clearly mentioned that the only 4 nerves are supplied by this medial plantar nerve. They are the abductor hallucis, flexor digitorum brevis, first lumbrical, and flexor hallucis brevis. So abductor hallucis brevis, flexor hallucis brevis, they are for the great toe, first lumbrical for the again toes, and the flexor digitorum brevis. These 4 muscles are supplied by the medial plantar nerve. Rest of all 13 muscles of the sol, they are supplied by the lateral plantar nerve. Now this knowledge, this you can say mechanical knowledge of the muscles and the nerve, if it is prepared in a two-way direction, that is nerves supplying the muscles and muscles supplied by nerve, then there are chances of the remembering very well. Before recapitulating that two-way in a manner, I like to go for applied part, because without applied anatomy or without application in a clinical setup, such mugging up will of no use. Waiter Tips hand is a Erb's paralysis, where upper trunk is damaged at the brachial plexus. Claw hand, that is an injury to the ulnar nerve, where the claw-like hand, like this, as if a paw of your cat. So claw hand type deformity will develop when ulnar nerve is involved, because majority muscles of the hand, they are supplied by the ulnar nerve. Wrist drop, like this. Wrist drop will occur in an injury to the radial nerve. Especially, it is also known as the Saturday night paralysis, when it is injured at your spiral groove of the arm. Winging of scapula occur because of the damage to your nerve to your serratus anterior, which is also known as the nerve of the bell or long thoracic nerve. When person pushes the wall or against the resistance, then scapula medial border will wing out, so it is a winging of the scapula. Deltoid paralysis will make unable to abduct the arm up to 90 degree. Above the 90 degree, abduction is taking place by the other muscles like serratus anterior and the trapezius muscle, upper and lower fibers. So above 90 degree, abduction is possible, but unable up to 90 degree, then injury to the axillary nerve or paralysis of the deltoid muscle, as the motor nerve supply of deltoid is the axillary nerve, which we had not mentioned earlier. Now, Saturday night paralysis, wrist drop, already we had discussed. Difficulty in a flexing, variable sensory loss, decreased thumb function, that is in a, you can say laborer's nerve, that is your injury to the median nerve, which get injured at the beyond the flexor retinaculum or after it, then produce a paralysis of the thumb. The intrinsic muscles of the hand, when it is damaged like ulnar nerve, then it is produce a claw hand. Now before some closure of our video, I like to give you idea that if you can follow the chronology like 1, 2, 3, 4, 5, then it is very easy. But if you have to recall like in reverse manner, like 10, 9, 8, 7, 6, 5, then your consciousness awakens, and that is helping in the memory. So we had seen nerves name and their muscle supplied, or muscle supplied and the nerves. Then it will be very easy to recall in extempore manner. So we had first of all sealed the 4 walls of axilla. Anterior wall pectoralis major and minor are supplied by the lateral and medial pectoral nerve. We had seen the lateral wall, that is a coracobrachialis and sort of biceps, supplied by the branch from the lateral cord, that is the musculocutaneous nerve. We had seen that the posterior wall of axilla, subscapularis and the teres major and the latissimus dorsi. So they are supplied by the branch from the posterior cord, namely upper subscapular nerve, lower subscapular nerve, and the nerve to latissimus dorsi, where lower subscapular nerve specially supplies the teres major. So similarly, when you had seen from the muscles to the nerve, you should also able to remember nerves to the muscles. For upper limb, say of branch from the root, rhomboides major nerve to rhomboides. So it supplies, which is suprascapular nerve, that is supplies not only supraspinous muscle but also infraspinatus muscle. Carefully you have to recall it. Similarly, musculocutaneous nerve supplies only three muscles front of the arm, so it is known as the chief nerve of the front of the arm. Those three muscles are in front of the arm, namely biceps brachii, brachialis and coracobrachialis. Your radial nerve supplies muscles back of the arm, that is the triceps muscles. He also supplies the three muscles of the forearm, namely brachioradialis, extensor carpi radialis brevis and anconeus. Other out of the 12 other 9 muscles of the back of forearm, they are supplied by the branch of the radial nerve, and that is the posterior introsus nerve. And you can say front of the forearm there are 8 muscles, out of which one superficial muscle and a half deep muscle, that is 1.5 muscle, are supplied by the ulnar nerve. They are the flexor digitorum superficialis and the ulnar half of the flexor digitorum profundus. Rest of all muscles are supplied by the median nerve or branch of the median nerve, namely anterior introsus nerve. So out of 5 superficial, 4 are supplied by median nerve directly. In the 5th flexor carpi ulnaris is supplied by the ulnar nerve. What are those 4 muscles supplied by the median nerve? First, pronator teres, second, flexor carpi radialis, third, flexor digitorum superficialis, or you can say 5th one, that is the palmaris longus. So in chronology, pronator teres, flexor carpi radialis, palmaris longus and the flexor digitorum superficialis. Now deeper muscles are 3. 2.5 are supplied by the anterior introsus nerve, which is a branch of ulnar quadratus. We had also earlier not mentioned this pronator quadratus, which is directly supplied by the supplied by the anterior introsus nerve, branch of median nerve, which is a last deeper muscles of the flexor compartment. Very recently we had concluded regarding the hands, there are 20 muscles. 12 muscles can be remembered by 2 names. Introsi muscle, they are 8, and the 4 are the lumbricals. Out of 4 lumbrical, lateral 2 are supplied by the median nerve, and the ulnar 2 are supplied by the your ulnar nerve. Your another still first and second lumbrical, and still 3 muscles of the thenar eminence. They are the abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. These 3 muscles and the 2 lumbricals, 5 muscles are supplied by the median nerve. So when median nerve is damaged beyond the flexor retinaculum, they produce a ape-like thumb. The paralysis of thumb will take place. Otherwise, this nerve is also known as a laborer's nerve because it supplies the major muscles of the forearm. So it is also known as a laborer's nerve. So remember regarding the median nerve. Now in comparison to the lower limb, there are lumbar plexus and sacral plexus, just like brachial plexus here. Lumbar plexus gives rise to the femoral nerve, which supplies the front of the thigh only. Sartorius and quadriceps headed by the largest branch of the sacral plexus. From the sacral plexus, largest branch is the sciatic nerve. Thickest nerve, the peroneal part supplies the, we can say, brevis fiber or adductor brevis muscle. And still from the sacral plexus, there is a superior and inferior gluteal nerve. It supplies the gluteal muscles. Now your abductor gluteus medius and minimus, when they get paralyzed, they produce a Trendelenburg sign. This is the applied anatomy as far as lower limb is concerned. When sciatic nerve is damaged, just like upper limb, there is a wrist drop. When sciatic nerve is involved, there should be a foot drop. So foot drop where your toes will be shuffle on the ground if patient tries to walk. So we had covered the muscles to the nerve supply. We had also recalled nerve supply, node and their muscles supplied by it. One very important idea or question came to my mind is the axillary nerve supplies how many muscles? It supplies 2 muscles. One is the deltoid, which if get paralyzed we fail to do abduction, and second muscles supplied by the axillary nerve is the teres minor muscle, and that branch of the teres minor is the containing pseudoganglion. This again very important point for your you can say MCQs. So which branch of the upper limb contains pseudoganglion? The nerves, axillary nerve, and is branched to the teres minor, has a pseudoganglion. Similarly, in the lower limb also there is a pseudoganglion, and it is when your deep peroneal nerve divides in a two division, lateral and medial dorsum, that is cutaneous nerve for the dorsum of the foot, that there is also the pseudoganglion in the dorsum of the foot, which occurs in a upper limb for the branch for the teres minor. So in a scapula there are 17 muscles, but if you will count around the shoulder there are 20 muscles. If you count around the forearm, 20 muscles and 20 muscles in the forearm. So there are 60 muscles of forearm, and this is how you can make a table and you can remember for repeated revisions. And if you will connect with the applied anatomy, it will have a future, you can say you can apply it in a clinical practice also. So with this, if any question answer, if there is a provision of the chat, I like to answer it, or if you cannot directly communicate, then you can message me and I will try to give the honest answer subsequently. Thank you very much. I will wait for a while if any response comes in the chat box for the question and answer. I'm looking for any chatting. On a phone up. हेलो हाँ